Well,
no problem at all.
All right.
Have a good day.
Thanks.
Bye-bye.
So here we are, Facebook Live, a little delayed, had a little trouble getting it to cooperate, but we're here. So for those of you who are listening, it's a pleasure to talk to you today. We're going to talk about anti-aging and reversing the aging process through bioidentical hormones and growth hormone releasing peptides. So as an anti-aging specialist, I've been in the anti-aging arena for the last 11 years exclusively. That's what I do as a medical doctor. And it's been a joy to be in. I've been a family physician for 40 plus years, 1974. And I love what I do. And I've had a lot of fun and I really have changed people's lives. But since I've been exclusively involved in this anti-aging process, the results have been just dramatically increased as to how much I help people reverse their lives and feel more youthful. Those of us who are getting more old in our physical body find that we have our brain just enjoying our life so much, but our body doesn't cooperate. And that creates a big problem, that we feel like, oh, gee, I wish I had the energy I had when I was younger, because now I'm filled with so much knowledge and wisdom, and I have such a greater appreciation for life, but I just get worn out, I get tired. We can reverse the aging process now. It's dramatic. It's not subtle. It's very dramatic. And we're going to talk about that today. How do you reverse the aging process through these bioidentical hormones and growth hormone releasing peptides? So what happens to men and women as we get older? Our bodies begin to slow down in terms of how much hormones we make. For women, women go into menopause somewhere between the age of, let's say, 45 and 55 on average, sometimes a little earlier, sometimes a little later. But when women go through menopause, it's dramatic. All of a sudden, a year later, you're not making any hormones like you used to be. And then you get tired. And then you feel irritable. You get moody. You don't sleep good. You lose the physical endurance to exercise. You lose the ability to enjoy activity. You lose libido. You're not interested anymore. This creates a huge problem in relationships. And the dramatic thing is that it's all reversible. For men, it's a little different. Men find that they lose hormones little by little by little. Slowly over the years, they begin to lose their hormones. When you're 40, it's less than when you're 30. When you're 50, it's less than when you're 40. You're 60, it's getting less. 70, it's a lot less. So for men, it's not as dramatic, but it still has the same kind of effects where you get less enthusiastic about things, less energy, physical energy, enthusiasm. You get less libido, you get less muscle stamina, endurance, and it takes longer to recover from exercise. This happens to men too. It's just a slower and less noticeable than it is in women. For both men and women, we can reverse this whole aging process, and it can do it dramatically. So we have a variety of interventions, but the most dramatic intervention is hormone replacement. Now, in 2003, there was a big study on hormones. 20,000 nurses. We measured how they did with hormones, and we found that, gee, when they had hormone replacement, they were dying younger. They were getting cancer and heart disease at a much higher ratio than women who were doing nothing. And so there was a lot of stuff going on in the research area, and doctors were saying, oh, women shouldn't take hormones anymore. But the truth of the matter is that the hormones they were using were not natural human hormones. They were synthetic progestins, not natural human progesterone. Synthetic progestin is not supposed to be in your body. Now, it has a purpose and a value if you're bleeding and you're having a big problem, but for And for hormone replacement, it's not appropriate. But really the problem has been that the research had been done by big drug companies who had millions and millions of dollars to do research. And they looked at the research and they said, well, we can't tell if hormones are good or bad. But over a period of years, it became clear that when you give natural human hormones to women, they live longer and healthier than if they did nothing. Whereas if you do synthetic hormones, you die younger. So that's like a huge change. It took a long time for the research to come out because who wants to do research on natural hormones? There's no money in it. No one's going to spend millions and millions of dollars to do research. But the research came out little by little, and that's what's clear to the researchers now, that you want to use natural human hormones to extend life. And compared to doing nothing, you live longer and healthier. So there's no reason to not use natural human hormones. So that works for women, and we find the same thing happens for men. Men who take testosterone generally, they get less heart disease, and they stay healthier, and they are more physically active. So it helps their brain, both men and women. So for men and women, we find that these natural hormones both help the reduce the incidence of heart disease and cancer, but it helps the brain. It helps you to have more youthful brain. It helps to keep your muscles strong and your bones strong. It helps all kinds of physical imbalances in the physiology. So we want you to be using these natural hormones to extend your life. It's a really wonderful thing. So side effects from these hormones are very minimal. We do have to measure your hormones. When people come in to see me, I measure lots of blood tests, 24-hour urine tests to look at hormone levels, to look at all different kinds of things. So there are many different things we want to look at to extend and promote youthfulness. We want to check for prediabetes. There are a variety of ways of measuring for prediabetes through blood tests. And we can tell way before you have diabetes that you're having prediabetes, and we can fix that problem. So we want you to remember that there are many other factors besides hormones that affect the aging process, but the hormones are really critical because hormones will help to prevent diabetes because you have more energy to exercise, you have more muscle stamina, more endurance, and that's very helpful. There's a variety of other issues that occur with aging that we can prevent. And we talked about your bones, making your bones stronger. So these are things that are really critical for your health and well-being. And I work with a group called Bioidentical MD, which has like 60 offices around the country. And my office here in Irvine, California is the one I've been in for 10 years. And we do a great job of balancing your hormones and creating that reversal of aging that we're looking for. And so it's an easy process. And if you want to be involved with that process, you can call my office, 949-222-0232. They can help you to guide you through that process so that you can get started with these bioidentical hormone replacement. I mentioned just a little bit about the hormones for growth hormone releasing. So we have what we call, it's not actually hormones, it's really a little peptides, a little protein that you inject. We have some oral ones that work too, but I think the injections are the best. And what we do with the little injections, you inject it 5 days a week into the belly fat. It's a little needle, insulin needle, very, very tiny. As we get older, men and women lose growth hormone production from the pituitary gland, which is supposed to be releasing it while you're sleeping. And as we get older, we use less and less of the growth hormone. So we find that it's less when you're 40, less when you're 50, less when you're 60. It keeps getting less and less and less. And the growth hormone is so important for activating all the other hormones in the body. is kind of like the conductor of an orchestra. It tells everything else how to move, what the rhythm is supposed to be, what the pace of activity is supposed to be. And the older you get, you just slow down. Everything slows down. When you have more growth hormone, you have more energy, you have more enthusiasm, you have more brain clarity, you have better memory, you have muscle strength, muscle stamina, endurance, libido, better skin tone. You sleep more, you dream more to rejuvenate the brain. These are great things. Growth hormone releasing factors work slower than the other hormones, testosterone and estrogen, progesterone. You feel better in a couple of weeks. Growth hormone is slower. It takes like 2 to 4 months to feel better. So you've got to have a different perspective on how that is. But we find that men and women who take it just feel more youthful. And their side benefits are just enormous in terms of youthfulness. So that's a big picture of what's going on. There's so many other things that we do to reverse the aging process, but this is like a critical foundational level. So again, I encourage you to call my office, 949-222-0232. You can go to my website, ocwellness.com, and you can see a whole bunch of things that we do to help you to stay youthful and to be younger. We have all kinds of things we do for injuries and for skin aging, and we have all kinds of great things we do. My wife and I run classes on marriage, and relationship is such an important factor in staying youthful. And we're going to do Facebook Live in just a minute on some issues related to relationship. And stay tuned. So we'll be with you in just a minute, and we're going to do that. And that's going to be on the Marriage Map Facebook. All right, you all. Look forward to seeing you in another week. Thank you all. Bye now.